I am on a mission to spread truth and empower people with knowledge, especially when it comes to senior health. And one truth we can no longer ignore is this: what may seem like mild or everyday discomfort could in fact be early warning signs of something far more dangerous. As a doctor who has worked closely with seniors for over 2 decades, I have seen far too many people dismiss small nagging issues, only to later discover they were the first whispers of cancer. The goal of this message is not to scare you, but to awaken you. Because when it comes to cancer, early detection saves lives. The problem is early symptoms often hide in plain sight, especially in older adults. They are subtle, they seem ordinary, and they rarely cause alarm until it's too late. Take fatigue, for example. Many seniors chalk it up to aging, but when that tiredness is persistent, especially if it worsens over time or interferes with your usual activities, it needs to be taken seriously. Chronic fatigue can be a sign of several cancers, including leukemia, colon cancer, and lymphoma. It's not just about being tired. It's about a body that is fighting something silently beneath the surface. And this fatigue is different. It's not the "I need a nap" kind of tired. It's a deep, bone-weary exhaustion that doesn't go away with rest. Unexplained weight loss is another red flag. It might seem like a blessing for some seniors, especially those who've been trying to lose weight. But weight loss that happens without changes in diet or exercise is not normal. Losing more than 10 pounds unintentionally in a short period should trigger immediate evaluation. It could be your body telling you that something is wrong, and often that something is cancer. Pancreatic, stomach, lung, and esophageal cancers frequently present with weight loss as one of their first symptoms. Then there's the issue of persistent indigestion or difficulty swallowing. Again, these symptoms are often attributed to age-related changes in digestion or dismissed as simple acid reflux. But if they persist beyond 2 to 3 weeks, it's essential to dig deeper. Esophageal cancer and stomach cancer often start silently with these very complaints. Seniors are at greater risk because their immune response is slower, and their symptoms may present more gradually, making them even easier to overlook. The biggest challenge is that these mild symptoms are not painful. They don't scream for attention, and because of that, most people ignore them. But when it comes to cancer, the quietest symptoms are often the most dangerous. In this article, we're going to expose these early signs, explain why they matter, and show you exactly what to do if you notice them. Because it's not just about living longer, it's about living smarter, stronger, and more in control of your own health. Your digestive system has a way of revealing what's happening deep inside the body, especially when cancer is silently brewing. Seniors often experience bloating, constipation, or a change in bowel habits, and most brush it off as normal aging or diet-related. But persistent gastrointestinal issues can be your body's way of sending a distress signal. Colon cancer, for example, rarely causes pain early on, but it can show up in subtle changes in your stool. Are you going more frequently or less than usual? Is your stool thinner, darker, or streaked with blood? These changes may seem minor, but they are not to be ignored. One particularly dangerous sign is blood in the stool, even if it's just a small amount or appears only occasionally. Many seniors assume it's hemorrhoids or something harmless. But any form of rectal bleeding should be evaluated immediately, especially if it is accompanied by fatigue or weight loss. Colon and rectal cancers often begin with minimal symptoms and progress silently. Early detection often comes down to whether a person is willing to notice and report changes that seem small. Appetite loss is another warning sign that's often overlooked. If you used to enjoy meals but suddenly find yourself skipping them or feeling full quickly, that's not normal. This could be an early symptom of stomach pancreatic or liver cancer. Seniors often don't connect appetite changes with disease because there's no pain involved. But your appetite is one of the most accurate indicators of how well your body is functioning. When it fades without a clear reason, you must investigate. Persistent nausea, especially when paired with weight loss or bloating, can also signal something serious. Liver cancer, for instance, may show up first with vague stomach discomfort or queasiness that just doesn't go away. And if there's any yellowing of the eyes or skin, even a light tinge, that's a sign of jaundice and could point to liver or bile duct cancer. I've seen patients ignore this subtle yellowing until it became severe. By then, precious time had already been lost. Let me be clear, these symptoms can have many causes, and not all of them are cancer. But that's exactly why they must be checked. Cancer is a disease of silence, especially in older adults. It creeps in slowly, showing up in whispers. The earlier we catch those whispers, the more likely we are to stop the disease before it grows louder and more deadly. Your digestive system may be the first to speak. Listen to it. Your skin is your largest organ and also one of the best mirrors for what's going on inside. Many seniors notice changes in their skin, but far too many shrug them off. That's a mistake. New moles. Sores that don't heal, patches of discolored or scaly skin. These can all be early signs of skin cancer, including the deadly melanoma. If you see a spot that changes in size, color, or texture, get it looked at immediately. Melanoma can spread quickly and is most treatable in its early stages. But cancer doesn't only show up on the surface. Lumps or swelling under the skin, especially in the neck, armpits, or groin, can be signs of lymphoma or other cancers. These lumps are usually painless, which is why they're often ignored. I had a patient in his 70s who came in for something entirely different. During the exam, I noticed a small rubbery lump under his jaw. He hadn't noticed it. That lump turned out to be an early-stage lymphoma. He received treatment early and recovered fully. But without that visit, it might have gone unnoticed until it was too late. Breast cancer in seniors isn't just a concern for women. Men over 60 can also develop breast cancer. Any new lump in the breast area, changes in the nipple, or unusual discharge should be evaluated right away. Skin dimpling, puckering, or redness around the breast are also warning signs. Don't assume age protects you. In fact, cancer risk increases with age. Even persistent itching or rashes can be signs. In rare cases, itching all over the body may point to blood cancers like leukemia or lymphoma. And certain skin rashes have been linked to internal cancers, including ovarian and gastrointestinal types. Again, the problem isn't that these symptoms scream danger, it's that they seem so ordinary. We must teach ourselves and our loved ones that any new or unexplained change on the skin or beneath it deserves attention. Seniors are especially vulnerable to brushing off these signs as just aging. But aging doesn't mean ignoring symptoms. Aging means being wiser, more attentive, and more proactive about our bodies than ever before. And when it comes to cancer, paying attention to your skin may just save your life. As we grow older, changes in voice, breathing, or even minor aches may not feel concerning. But as a doctor, I encourage every senior to listen more closely. A hoarse voice that lasts more than 2 weeks, or a chronic cough with no clear cause, can be an early symptom of lung or throat cancer. Most people expect cancer to cause pain, but lung cancer, for example, often begins without any. The first clue might be shortness of breath during mild activity, or even just a dry cough that won't go away. If you feel pain in your chest, shoulder, or back that persists and does not follow a pattern of strain or injury, it could be referred pain from cancer in the lungs or surrounding tissues. Bone pain at night, or that doesn't improve with rest, may indicate bone metastases. Seniors often accept aches as part of life, but unexplained, persistent, or progressive pain should never be accepted without question. Difficulty swallowing or a persistent sore throat can also be warning signs of esophageal or throat cancer. And if your voice changes, becomes raspy, weak, or breathy, that might indicate tumors pressing on vocal cords or nerves. A sense of fullness in the neck or trouble breathing while lying down could be signs of thyroid or lymph node involvement. Headaches that are new, especially if they occur more frequently or severely, can in some cases point to brain tumors. This is particularly concerning if the headache comes with nausea, vision problems, or confusion. Seniors sometimes don't report these symptoms because they fear the implications, or they worry they're bothering their doctor. Let me say this clearly. You are never a bother when it comes to your health. In fact, you are your first and best line of defense. Reporting your symptoms early gives your doctor the chance to act early, and that can change everything. Pain is your body's language. It's trying to tell you something. And while not every pain is cancer, every pain deserves to be heard, especially when it doesn't go away, when it changes over time, or when it shows up in strange places. The body keeps score. Listen to it. So what should you do if any of these symptoms sound familiar? First, stay calm. Most of these signs can be caused by non-cancerous issues, but that doesn't mean you ignore them. The key is timely evaluation. Schedule an appointment with your primary care provider and explain your concern clearly. Be specific about how long the symptom has been present, how it has changed, and how it's affecting your life. Second, request the appropriate screenings. Depending on your age and symptom, this may include blood tests, imaging like CT or MRI scans, endoscopies, or biopsies. Don't be afraid to advocate for yourself. If you feel your concerns are not being taken seriously, seek a second opinion. Cancer is too important to leave to chance. Third, maintain a symptom journal. Document how you feel daily. Include any patterns, changes, or triggers. This gives doctors better insight and helps you stay connected to your body. Fourth, stay up to date with recommended screenings, including colonoscopies, mammograms, prostate exams, and skin checks. Many cancers are treatable when caught early, and routine screening is your best weapon. Fifth, strengthen your overall health. Eat a diet rich in fruits, vegetables, lean proteins, and whole grains. Stay hydrated. Move your body daily, even if it's just a walk. Reduce your exposure to toxins such as tobacco, excessive alcohol, or harsh chemicals. Your immune system is your silent ally. Fuel it well. And finally, spread this message. Talk to your family, friends, and community. Encourage others not to ignore the small things. Early detection doesn't just save lives. It protects families, preserves independence, and empowers aging with dignity. If you're over 60, these symptoms may feel familiar. Don't panic. Don't delay. Just act. Because awareness is strength, and prevention is power. If you found this message valuable, please subscribe to our channel. Leave a comment to share your thoughts, and pass this video along to someone who needs it. Together we can turn fear into action, confusion into clarity, and silence into survival, into